Hello friends, welcome back to Health Revival. Blocked arteries occur when fatty deposits, known as plaque, accumulate along the artery walls, reducing the flow of oxygen-rich blood. While this is commonly associated with heart disease, it can also affect the legs and feet, leading to a condition called peripheral artery disease, PAD. The arteries in the legs supply muscles and tissues with the blood they need to function properly. When these arteries become narrowed or blocked, circulation is restricted, causing discomfort and increasing the risk of serious complications. Blocked arteries in the legs and feet are more common in individuals over the age of 50, particularly those with underlying health conditions such as diabetes, high cholesterol, and high blood pressure. Smokers and people with a sedentary lifestyle are also at greater risk. The condition is more prevalent than many realize, affecting millions worldwide, yet it often goes undiagnosed until symptoms become severe. Without proper treatment, PAD can lead to severe pain, infections that heal poorly, and, in extreme cases, tissue death that may require amputation. Poor circulation can also be a warning sign of widespread artery disease, increasing the likelihood of heart attacks and strokes. Recognizing early signs and making lifestyle changes, such as exercising regularly, maintaining a balanced diet, and quitting smoking, can improve circulation and prevent complications. Here are 10 important warning signs that may indicate blocked arteries in your legs and feet. 1. Leg pain while walking. One of the earliest signs of PAD is cramping, aching, or burning pain in your legs when you walk, climb stairs, or engage in physical activity. This pain, known as claudication, typically starts in the calf but may also affect the thighs, hips, or buttocks. It occurs because the muscles need more oxygen during movement, but narrowed arteries fail to supply enough blood. The pain often eases with rest as the oxygen demand decreases. However, as the condition worsens, discomfort can persist even when you are inactive. This suggests that circulation has become severely compromised, depriving muscles of essential oxygen even at rest. Many people dismiss this pain as normal aging or muscle fatigue, but it is an early warning sign of restricted blood flow. Ignoring it can lead to progressive worsening, making even short walks or standing for extended periods difficult. Over time, reduced circulation can harm leg and foot tissues, increasing the risk of ulcers, infections, and, in severe cases, tissue death. A persistent lack of oxygen can cause slow wound healing, raising the chance of complications such as gangrene, which may necessitate medical intervention. Improving circulation through lifestyle adjustments can slow disease progression. Regular physical activity, even at a moderate pace, encourages better blood flow. Maintaining a diet rich in heart-friendly foods helps keep arteries clear. If pain in your legs occurs frequently with movement, seeking medical advice is crucial. 2. Numbness or weakness in legs. When arteries become blocked, the nerves and muscles in your legs struggle due to reduced blood supply, leading to numbness, tingling, or persistent weakness. The sensation might feel like pins and needles, or your legs may seem unusually heavy and difficult to move. Even short walks can become exhausting, and the discomfort can worsen over time, making it harder to climb stairs or stay active for extended periods. Poor circulation can also interfere with nerve function, making it difficult for your legs to send and receive proper signals. This may result in coordination problems, increasing the likelihood of tripping or falling. If the condition progresses, standing for long periods can become a challenge, and pain may persist even while resting. In severe cases, the nerves might be so deprived of oxygen and nutrients that sensation is lost, making it difficult to notice cuts, bruises, or infections. Without treatment, these unnoticed injuries can develop into serious complications, including ulcers and infections that take longer to heal. If you notice these symptoms, a doctor can check circulation by assessing the pulse in your feet, measuring blood pressure variations, or using imaging tests to examine blood flow. Staying active, eating heart-healthy foods, and quitting smoking can improve circulation and slow the progression of arterial disease. 3. Cold feet or legs. When blood flow is restricted, one leg or foot may feel significantly colder than the other, even when exposed to the same environment. This happens because the arteries are unable to deliver enough warm, oxygen-rich blood to the affected limb. If you consistently notice that one foot or leg is colder than the other, it could indicate a blockage limiting circulation. The difference in temperature may not always be dramatic, but if it persists, it is worth paying attention to. Cold limbs can also lead to discomfort, numbness, and, in severe cases, tissue damage if circulation continues to decline. To check, compare both legs by touching them with your hands. If one consistently feels colder than the other, especially along the toes and feet, it is an important sign that should not be ignored. Wearing socks or warming the leg may provide temporary relief, but it does not address the underlying problem. Medical evaluation is paramount if the condition worsens or is accompanied by other symptoms like pain, discoloration, or sores that do not heal. Sores or wounds that won't heal. If you have cuts, blisters, or sores on your feet or legs that take an unusually long time to heal or do not heal at all, it could be a sign of poor circulation. Blood carries oxygen and essential nutrients that help repair damaged tissue. Even small injuries struggle to heal properly when circulation is compromised due to blocked arteries. The lack of blood flow means the body's natural defense system cannot work efficiently, increasing the risk of infections that can quickly worsen. In more severe cases, untreated wounds can develop into painful ulcers or open sores that may not respond to standard treatments. If left untreated, these ulcers can progress to gangrene, a condition where the tissue starts to die due to a lack of blood supply. This is a serious complication that may require surgical intervention, including amputation in extreme cases. If you notice that wounds on your feet or legs are not healing as expected, do not ignore them. Keeping your feet clean, wearing comfortable shoes, and avoiding minor injuries can help, but it is essential to address the root cause. 5. Shiny, thin, or discolored skin. Skin texture and color changes often indicate poor circulation, an early warning sign of blocked arteries. When blood flow is restricted, the skin on the legs and feet may appear unusually shiny, thin, or stretched, making it more fragile and prone to damage. The affected area may also change color, turning pale due to reduced oxygen supply or becoming bluish when blood struggles to return to the heart. In some cases, the skin may develop a reddish or purplish hue, particularly when the legs are lowered, as gravity pulls stagnant blood into the lower extremities. Poor circulation also makes the skin more sensitive to temperature changes. Some people may feel that their legs are colder than usual, while others may experience an odd sensation of warmth due to inflammation. These changes can make the skin more vulnerable to dryness, cracking, or sores that take longer to heal. In extreme cases, long-term oxygen deprivation may damage tissue, increasing the risk of infections and ulcers. Taking care of your skin by keeping it moisturized, avoiding injuries, and wearing comfortable footwear can help protect it. However, these external solutions do not address the root cause. If you notice persistent skin texture or color changes, consult a doctor for an evaluation. 6. Hair loss on legs and feet. Hair growth depends on a steady supply of oxygen and nutrients, both of which are delivered by the bloodstream. When circulation is compromised due to blocked arteries, hair follicles do not receive enough nourishment, causing hair to grow more slowly, become thinner, or stop growing altogether. This is particularly noticeable on the lower legs and toes, where blood has to travel the farthest from the heart. If you observe sudden hair loss or smooth, bald patches on your legs, it could be an early sign of a vascular issue. Many people overlook hair loss on the legs, assuming it is a natural part of aging, but when combined with other signs such as cold feet, numbness, or skin discoloration, it may indicate reduced circulation. Without adequate blood flow, the skin and hair follicles become deprived of essential nutrients, weakening their ability to function properly. Over time, this can contribute to other problems such as dry, flaky skin, slow wound healing, and increased sensitivity to temperature changes. 7. Weak pulse in feet. If you find it difficult to feel a pulse on the top of your foot or behind your ankle, or if one foot has a noticeably weaker pulse than the other, it could signal a blockage in your arteries. A weak or absent pulse means that blood is struggling to reach the lower limbs, which can result in discomfort, numbness, or even tissue damage over time. Checking your pulse at home can provide an early clue about your circulation health. Place your fingers lightly on the top of your foot near the base of your big toe or behind your ankle bone. If you struggle to locate a pulse, try repositioning your fingers slightly or applying gentle pressure. If your pulse is consistently weak or difficult to find, particularly when combined with symptoms like leg pain, cold feet, or skin discoloration, seeking medical attention is crucial. A doctor can conduct further tests, such as an ankle brachial index (ABI) test, which compares blood pressure in your arms and legs to detect circulation issues. If poor circulation is confirmed, lifestyle changes such as regular walking, maintaining a healthy diet, and quitting smoking can help improve blood flow. 8. Leg fatigue or heaviness. Feeling tired or experiencing a sensation of heaviness in your legs after only a short period of activity can be a sign of PTH. This is not the usual fatigue that follows exercise but rather a persistent weakness that improves with rest, only to return when you start moving again. When arteries are narrowed or blocked, muscles in the legs do not receive enough oxygen-rich blood to function efficiently, causing discomfort, tightness, and exhaustion. Many people mistake this symptom for normal aging or a lack of physical fitness, but it is often an early warning sign of circulation issues. As the condition progresses, the heaviness can become more pronounced, making it difficult to carry out daily tasks such as climbing stairs, walking for extended periods, or standing for long stretches. In more advanced cases, the fatigue can persist even at rest, indicating that the arteries have become severely blocked. Improving circulation through lifestyle changes can help reduce these symptoms. 9. Muscle atrophy. When muscles don't receive enough oxygen and essential nutrients due to restricted blood flow, they gradually lose their strength and size. This condition, known as muscle atrophy, occurs when tissues are deprived of the necessary support to maintain their function. Over time, you may observe that your legs appear noticeably thinner or weaker than before. They may also feel less firm, making everyday movements like walking, climbing stairs, or standing for extended periods more difficult. Muscle atrophy is a serious sign that the arteries supplying blood to the legs and feet are significantly narrowed or blocked. When circulation declines, muscle fibers start breaking down, and the body struggles to repair or rebuild them. The lack of nutrients not only weakens the muscles but also affects coordination, increasing the risk of falls and injuries. The discomfort may be accompanied by fatigue, making physical activity feel exhausting even after minimal effort. Preventing muscle atrophy requires improving blood circulation. Engaging in low-impact exercises such as walking or swimming can help keep the muscles active and encourage better blood flow. 10. Erectile dysfunction in men. Reduced blood flow due to blocked arteries affects more than just the legs. In men, it can contribute to erectile dysfunction, as proper circulation is essential for maintaining an erection. When arteries are narrowed, the blood supply to the pelvic region may become insufficient, leading to difficulties with sexual performance. This issue is often overlooked or attributed to other causes, but it can be an early warning sign of vascular disease. A sudden onset of erectile dysfunction, particularly in men who also experience leg pain, numbness, or cold feet, could indicate circulation problems. The same plaque buildup that restricts blood flow to the legs can also impact the arteries supplying the reproductive organs. Since these arteries are smaller and more sensitive to blockages, erectile dysfunction may appear before other noticeable symptoms of poor circulation. Ignoring this sign may lead to worsening vascular health. Addressing it early by improving circulation can prevent more severe complications. Simple tips for better vascular health. Making lifestyle changes can help improve circulation and prevent further complications. Quitting smoking is one of the most effective steps, as smoking damages blood vessels and accelerates plaque buildup. Staying physically active, even through gentle activities like walking, helps keep arteries flexible and promotes healthy blood flow. Managing conditions such as diabetes, high blood pressure, and cholesterol levels is essential, as these conditions contribute to artery damage. A diet rich in fruits, vegetables, whole grains, and lean proteins supports heart health and keeps blood vessels functioning properly. Monitoring symptoms regularly and seeking medical advice when noticing persistent leg pain, numbness, or slow-healing wounds can prevent severe complications. Taking these steps consistently helps maintain strong circulation and reduces the risk of developing more serious vascular issues. In conclusion, Your legs can tell you a lot about your heart health. Don't ignore pain, numbness, or changes in your skin, nails, or hair. Recognizing these signs early can help prevent serious complications. Your health is in your hands. Stay alert, stay informed, and seek medical advice when needed. If you found this information helpful, don't forget to like, share, and subscribe to Health Revival for more valuable health insights. Turn on notifications so you never miss an update on important health topics that can help you stay informed and take better care of your body.